My name is Michelle Hamilton, and I'm here with my colleague and good friend, Mara Pinot. We are two oncology dietitians here at the UT Southwestern Harold C. Simmons Comprehensive Cancer Center. This video was created to discuss some ways to manage treatment-related symptoms. These shorter videos, like this one here, will cover each individual symptom. For a full overview, please click on the longer video for staying nourished during treatment. Nausea can be caused by a variety of reasons, and these can often build upon each other. We want to prevent nausea as much as possible because it can lead to other problems. It can affect what we are able to eat and drink, which can lead to weight loss or abnormal blood work and potentially lead to a delay in treatment or a visit to the emergency room. For symptom management, you may be prescribed one or more medications to take at home for nausea. You may also receive some nausea medications through your IV before your infusion. Your team of nurses and providers will provide some additional details on medication management, but it is very important to notify your team if these medications are not working for you. Do not be afraid to be the squeaky wheel because we really don't want you to be nauseous at home. From a nutrition standpoint, focus on those small, frequent meals and take it slow in order to prevent feeling overly full or uncomfortable. When possible, drink your fluids separately from your meal. Some fluid is okay with meals, but try to drink the majority of your water or fluid in between meals. Again, we don't want to overwhelm your stomach and make the nausea worse. Make sure that you are sitting upright for at least 1 hour after eating the meal. If you lie flat after eating, it may feel like the food is coming back up, and that won't feel very good at all. For severe nausea, it may be beneficial to time your meals around your medication, and that may make sure that you're feeling your best whenever you are trying to eat during the day. Focus on bland foods, nothing too spicy or greasy. Sometimes a cracker or a piece of bread can help calm down the stomach. Rinse your mouth out with water or the homemade mouth rinse to clear any unpleasant smells or films in your mouth. Try using peppermint or lemon drops to freshen up your mouth. Peppermint has been researched for its natural anti-nausea benefits. Try to avoid skipping meals when you can. This can lead to poor appetite and snowball into other challenges. And finally, wear comfortable clothes that are not tight-fitting, nothing too restrictive. As a reminder, these are just a list of suggestions. What works for someone else may not work for you. There may be a trial and error period to find the best routine or solution for you, but we encourage our patients to continue to try things and continue to update the team on how you are feeling. Once the nausea subsides, and our goal is for it to go away as quickly as possible, you are welcome to return to your normal diet pattern. Additional food suggestions are listed on this slide. Sticking with the theme of nothing too spicy or greasy, sometimes high-fat foods can sit heavy on our stomachs and contribute to nausea, but not always. You may have heard of the BRAT diet before. This stands for bananas, rice, applesauce, and toast. It's a simple acronym that can help you remember to stick with mild, bland foods. However, this diet is meant to be used as a temporary solution as it limits a wide variety of foods and nutrients, including protein. If you do experience vomiting, make sure to sit upright, try to allow for small breaks to make sure that the episode has resolved before eating anything. Then start with clear liquids and gradually increase your diet from there. Make sure to call your medical team if you are unable to keep anything down for more than 24 hours. Here are some additional suggestions for nausea management that may be beneficial. Ginger has an anti-nausea soothing effect. Consider trying ginger chews, ginger tea, or even ginger candies. Bracelets or acupuncture can be helpful for some, and massage, yoga, or relaxation techniques can help reduce stress and distract the mind. We often hear from patients that this can be hard to visualize what a day is like with small meals. Over the next several slides, we will provide a timeline and layout of what to take in order to get in the recommended calories, protein, and fluid throughout the day. 2,000 calories may be too much or too little for some patients, but this is a good average to give you a practical example of a day or small meal. And we'll go through about 7 meals and sticking with the goal of every 2 hours. Starting off at 8 a.m., a breakfast would include a bowl of cereal, banana, and glass of milk or lactose-free milk. Plant-based dairy products are fine, but make sure to compare the calories and grams of protein as they vary greatly with plant-based dairy products. A snack around 10 a.m. includes a couple of hard-boiled eggs, cold to prevent less odor if tolerated that way, and toast and a cup of water or juice. The next meal around 12 p.m. contains a small amount of chicken and rice with ginger ale. So you can see that we are sticking with every 2 hours and mostly mild foods. The next snack at 2 p.m. is a small bowl of soup with crackers and an Ensure Clear. The Ensure Clear protein drinks can be sometimes easier whenever you're having nausea. So that is why we chose this product over the regular Ensure or Boost. Another small meal around 4 p.m. would include a good source of protein, crackers, and cup of water. The dinner meal contains a small serving of mashed potatoes, another clear protein drink. Here we've chosen Unduri chicken soup flavored protein powder that can be mixed with water. Finally, we have made it to the end of the day with our last meal of a Boost pudding and another glass of milk. We aren't saying that this is easy, but it is feasible, especially with the right team and support around you. Final tips: eat by the clock and stick with the schedule. Keep a close eye on your weight and contact your dietitian for more specific meal and snack ideas.
Here's some additional resources. These are resources that us dietitians use on an almost daily basis. At the bottom is the UT Southwestern Oncology Nutrition website. That's a great one to go to. A lot of information just based on what we provide and recommend within our patient populations. American Cancer Institute for Research is another great one. So reach out to either your dietitians on your team or to these resources for more research-based information. And thank you everyone for listening into this presentation. If you have any questions whatsoever, please reach out to your medical team. And if you don't know your dietitian, they can let you know who that dietitian is. And if you do know your dietitian, please reach out if you have additional questions. Thank you so much and have a great day.
Thank you.